everybody. If you look at the definition of exercise in a dictionary, it's called as a physical activity which improves health. This one line sums up the whole idea. We call them as stretch exercises when we move our joints to their full range of motion, and what it does, it stretches and makes the muscle tense and eventually causes the relaxation. This is something that should be done before we undertake any form of exercise. Strength exercise where the body works against resistance, maybe weights or maybe against your own body weight or against gravity. And aerobics, exercise whose main effect is increase in the heart rate. So they are also called as cardio. The oxygen demands of the body increases when we exercise, and the heart tries to pump blood more times in a minute to meet this demand. But there is a maximum that it can reach, and that is dependent on age. The maximum heart rate roughly a person can achieve is 220 minus age. So if you're 20 years, it could be 200, but if you're 60 years, it would be somewhere around 160. When exercising, you reach less than 60% of your target heart rate. It's called mild, 60 to 80% is moderate, and more than 80% is severe. And you look, many of those exercising machines, they have some bars which you can hold, and it immediately gives you the pulse. And they want to display the pulse only to tell you at what severity you are working. With time, with training, the heart develops a modification. Instead of pumping more times, it pumps harder every time. So pumps out more blood with each beat. So when you are trained, the increase in heart rate, which happened earlier with the same level of activity, now does not happen. This improves both your peak activity levels and your endurance. Athletes generally have lower heart rates when they are at rest, just to tell how effectively they can pump with each beat. The effects of exercise, one is it's an energy consuming process. The energy consumption is just taken as a rough idea because everybody will have different metabolic rates, but we just adjust it for your weight and the level of activity. There are lots of apps to follow this, or maybe just follow an algorithm. What this burning calories does, it burns the fats. What exercise also does, it builds up muscles. So if you're trying to lose weight and you exercise also, you will lose fat, but you might build up a little bit of muscle. That's very good. So if you want to know how much fat you have lost, just measure your abdominal girth. Roughly around an inch loss would mean losing around 3 kgs. 2.5 kgs also depends on what weight you are, but that's a rough idea. And exercise gives you a very good feel. It brings routine in your life. You're spending some time to yourself. All these improve your cardiovascular health and metabolic health. So improves diabetes, improves hypertension, the risks of cardiac diseases. It trains the heart. We believe, as I said, the modification in the heart is beneficial with exercise. It also tests the heart. So if you have a compromised heart, if you have cardiac disease, you start exercise and you feel symptoms because there is a mismatch between how much oxygen can be supplied and how much the heart takes, you feel discomfort. The most important of which is chest pain. So if you exercise, not only improve your heart, but you also get signals from your heart early. It is proven that regular exercise improves lifespan, and here there is no concern, it increases the healthy lifespan. It regulates your blood sugar by decreasing your fats, by increasing your muscles, and overall improving the other metabolic parameters including insulin resistance. It has a BP lowering effect. It improves the cholesterol profile. It may decrease its amount also. And it improves the bones. So osteoporosis, exercise is protective. So your muscles also improve in their functioning. They start utilizing the oxygen much better. That is also another reason why aches and pains go away, because aches and pains is all about some amount of inefficient metabolism. So that part is taken care of. What are the concerns then? The concerns are the increased oxygen needs with exercise. So these are mainly in patients who already have cardiac disease. You have cardiac dysfunction, some kind of limitation, maybe severe lung disease. There you should have a guided exercise. Somebody tells you to what level you should exercise. And you can track your heart rate as an indicator, maybe still hunt for some kind of mild physical activity, because all patients who indulge in physical activity, whether they have cardiac disease or lung disease, do much better, both symptomatically and in terms of lifespan. In diabetics, it can cause hypoglycemia because it's an energy consuming process. That's good. The only thing is that you should be warned about hypoglycemia and you should be ready for it. Some people say take a snack before exercise and after exercise to take care of hypoglycemia. Well, not a great idea if you're trying to lose weight as well. That's like adding excess calories in terms of foods. You just need to adjust your medicines, and your activity should be tuned to the timing of your medicine, especially if it's insulin. So you develop your own behavior so that hypoglycemia is avoided if you are a diabetic. How to make up the plan if you've not started? Well, 10 minutes of stretch exercise, 10 minutes of strength exercise, you can do more of it, and maybe 20 minutes of aerobics, something like 30 to 40 minutes a day. You can approach a trainer to help you initially, especially with the stretching and strength exercises. And cardio is swimming, cycling, jogging, running, so something you can do on your own. Make a plan and look at how is it affecting your metabolism, your metabolic diseases. And if you are trying to lose weight, also track your abdominal circumference. And always remember, the energy spent on exercise is still very modest. So if you do not take care of the calories from food, you may not be able to achieve decrease in body weight. This is desirable for those who are obese, but otherwise for all who exercise and are at normal body weight, you just try to keep yourself at neutral body weight. Make exercise as a part of your schedule, only then it is possible. I think there are more mental challenges to exercise than physical ones. If you get it as a part of your daily activity, and if it is something which gives you a good feel, I believe personally that you are likely to exercise regularly and for long.